So, firstly, good afternoon, everybody. Once again, my name is Farizal for Dr. Sayam. I'm the acting CEO of the Malaysia Healthcare Travel Council. So, with me today are our representatives of the flagship medical tourism hospital program, which I will go into a little bit more detail as we go into the program. Um, so for us, thank you so much for conducting this interview today. It definitely will provide us the right platform to showcase the first of its kind medical tourism program in this region, if not the globe. So a little bit about the flagship program. The flagship medical tourism hospital program was initiated by the Malaysia Healthcare Travel Council, MHTC, in 2022. And we received full endorsement from the government of Malaysia, as well as the Ministry of Health Malaysia. Through the flagship program, we strive to position Malaysia as a globally recognized leader in healthcare through the recognition of the renowned healthcare travel icons. MHTC partnered with IQVIA as well as Joint Commission International, JCI, to drive this collaboration effort and co-develop a stringent assessment framework that featured 51 perimeters across the three key pillars, which are medical excellence, service excellence, and international branding. Following the assessment, four hospitals emerged as the front runners, and they progressed into the acceleration phase, which you see them here today. These finalists are the Institute Jantung Negara, or the National Heart Institute, Island Hospital, Mahkota Medical Center, as well as Subang Jaya Medical Center. So with me today are the representative of these four flagship finalist hospitals, whom we are very proud of. Number one, in alphabetical order, is Datuk Akmal Arif Muhammad Fauzi. He is the Deputy Group CEO of the National Heart Institute. We also have here with us is Miss Lim Kui Ling. She's the Chief of Staff of Island Hospital. Mr. Stanley Lam, CEO of Mahkota Medical Center, and Mr. Brian Lin, the CEO of Subang Jaya Medical Center. So without further delay, I'm going to hand over the floor to you, Dr. Sayam, to begin the interview session.
It's a great pleasure to meet all the CEOs of four finalist hospital from Malaysia. So I would like to know a few more things from you. Firstly, I would like to know from Datu Akmal Arif about how was your journey into the acceleration phase of this program been like? Would you please share some details?
Okay, thank you very much for the question. As a hospital that has been established 30 years ago, we have had journeys or various accreditation or quality that we have embarked. So our journey with the program has been very, very exciting. We know that we are being audited, we are being assessed, we are being monitored more focus for the next 3 years. We have our own 3-year business plan, 5-year business plan that covers a whole range of activities and initiatives. This flagship program automatically becomes part and parcel of what organization needs to be doing for the next 3 to 5 years. And what more, this being a national agenda, and IJN has always been supportive of any national agenda. So all those encompasses as much as possible what we would like, our hospital, as well as the program that we are together with MHTC, JCI, and IQVIA for the next 3 years. Thank you. Well, in short, it has been a good journey.
Thank you for sharing your experience from a very reputed institute and your experience on this program. Thank you. Now I'd like to ask Ms. Lim, what inspired you to participate in this flagship medical tourism hospital program?
Hi, Dr. Sayam. Hi from Penang. So Penang is a beautiful island on the northern part of Malaysia. We are UNESCO World Heritage Site. And a little bit about Island Hospital. We were founded 27 years ago, and we have been active in medical tourism since the early days of our founding. So as one of the early adopters and a market leader in medical tourism, Island Hospital has actively invested in growing and developing our infrastructure, as well as our expertise to meet the needs of our local as well as international patients. So in the past 5 years, we have invested close to 200 million US dollars into expanding our physical infrastructure, adopting medtech and digitalization, international accreditation, as well as expanding our human capital. So we have recently doubled our hospital capacity from 300 to 600 beds, and we are planning to be a 1,000 bedded hospital in the next 5 years. So this is our commitment to taking medical tourism for Penang as well as for Malaysia to the next level. And of course, we aspire to be a leading regional quaternary healthcare provider, not only to offer best in class service, but also value for money. I think that is very important as a value proposition to our patients. So this flagship program synchronizes strategically and is perfectly timed with our business plan, and in line with our efforts to be one of the biggest and most prominent medical establishments in Southeast Asia. Thanks.
Many thanks for sharing your future plan with us. Now I'd like to ask Mr. Stanley Lam from Mankota Medical Center. What is your anticipated outcome of participating in this program? Would you please share some light?
Thank you. Thank you, Dr. Sayam. And first of all, again, I would like to say good afternoon to you and to MHTC as well. And we have to thank MHTC for coming out with this program. So one of the main difference when we attend this program certification is that we're using a team approach instead of a single approach when we provide a treatment plan to our patients. So this is something that we have been championing, and it is also aligned with what this program has been crafted, towards the medical excellence side. In terms of service excellence, we have been always very patient-centric. One of the challenges of our hospital is that we don't have a nearby airport in our hospitals. And for the patients who come over to us, it always have to go through the KLIA, the international airport, whereby it will take them 2 hours drive to come to hospital. So in fact, because of that, we have been enhancing in terms of how are we going to be more very patient-centric across all the key touch points, including before they come to the hospital and when they touch down in the hospital and when they touch down into our country. So all this has stemmed the hospitals to provide a lot of services compared to others counterparts, whereby the airport just is nearby to the hospital itself. Again, even with this kind of gaps, we are able to attract about 100,000 patients per year to come to our hospitals from foreign lands, right? So in terms of the international branding, again, this hospital has been very active in carrying out a lot of CSR projects, and I just inform you that in fact we have planned something for Bangladesh as well, right? So we are not just doing a sort of a CSR project in Malaysia itself, but being a responsible citizens in foreign lands, and this is our commitment. And our commitment is not just to the local community, but also to the regional community itself.
Many thanks, Mr. Stanley Lam. It's great to know about your commitment towards Bangladeshi people. So now I'd like to know from Subangja Medical Center that the flagship medical tourism hospital program is based on 3 main pillars, as we got to know: medical excellence, service excellence, and international branding. So how do you feel your hospital has fared in these 3 aspects till date?
Right. Very good afternoon, Dr. Sayam. Thanks for coming online and to have a meeting with us. And in terms of how we fare, right, in these three key pillars, I would say Subang Jaya Medical Center excel in medical excellence and service excellence. But for international branding, we have a little bit more work to be done in that area. So in terms of medical excellence, Subang Jaya Medical Center is known for publishing outcomes, clinical outcomes. For example, we publish our outcomes on breast cancer. Our 5-year survival rate is about 85% compared to other industrial nations. So these are already published in medical journals. But we are continuing working on publication and telling the world what the hospital or Subang Jaya in particular can do in colorectal surgery, lung cancer, stem cell, leukemia treatment for adults and pediatric. So such publications are in the works. So we will share with you once we get the paper finalized. So HMC actually excel very well in medical excellence because we are accredited by JCI. We are accredited locally by MSQH. We are accredited by Royal College of Pathologists of Australia. So we have done actually very well in terms of medical excellence, and we continue to invest in our medical know-how. So in terms of service excellence, we are one of the first hospitals that introduced electronic medical records. So everything is paperless. So once people come in, everything is electronically captured, and all information are captured. So the previous doctor who treated you in Subang Jaya will know, okay, what need to be treated by a new hospital, a new doctor. So it's all linked into electronically. And also in recent months, we also invested in what we call a 1Q system, where patient is given a queue number, but then they can roam anywhere in the hospital. They can go to Starbucks, they can go to any outlet and wait there, but then they'll be prompted on the handphone, you are next to be seen by a doctor. So then you make their way from Starbucks up to the doctors who are located, let's say, on the 3rd floor. So we are actually continue to invest in terms of our service excellence. And the other thing that we build in is a culture of service. We have a one-stop international patient center that take care of health tourists the moment, okay, before they arrive. We will do the visa processing for them, work with MHTC and immigration department, get their visa ready. Once they board the plane, they arrive in Malaysia in the airport, there is someone to pick them up and then send them to the hospital or send them to the hotel of their choice. And then even when they are in the hotel of the choice, okay, we will go and pick them up into the hospital. And then there is a translator and interpreter, to actually accompany the patient. So because sometimes, or because of the language barrier, communication is hindered, this translator will provide the connection. So we go end-to-end service in terms of that service delivery. And the other thing about Subang Jaya is we believe in this culture of people caring for people. We believe that, you need to take care of the people in order for the people to take care of the patient, take care of the customers that come through our door. So we have a very strong this mantra that's built into the hospital. So in terms of, let's say, international branding, we are recently also being recognized by Frost & Sullivan for 2 consecutive years as Malaysia Hospital of the Year. We are actually working with MHTC and also working with Global Health Publication to showcase our services internationally. So these are the areas actually SGMC or Subang Jaya Medical Center is working on to build and continue to progress and develop our hospital services, and also shout out to the public and to international audience about what is our capabilities and what is our capacity in terms of delivering excellent medical healthcare. So I hope that answered the question.
Yeah, absolutely. Absolutely. It's nice to know about your system, how you are running your hospital. It must be a state of art. Now I'd like to know from Miss Lim of Island Hospital, how do you see your hospital contributing towards elevating Malaysian healthcare brand on a global scale?
Well, that's thanks for the question. I think our commitment towards enhancing healthcare service delivery is without a doubt I believe that we continue to show this through our commitment to adopt digitalization. We are also a 100% EMR hospital. And why digitalization is important? Because it is a very important tool to improve the quality of our service and care delivery. We also recognize that patient engagement is key, and there's no one size that fits all. I believe that patients from diverse ethnic and cultural backgrounds will all need to have a different level of personalized care and attention. So this is part and parcel of what we call value-based healthcare, and we want to focus on improving the quality of care while managing costs and personalizing delivery according to needs of the individual patient. So this must encompass upskilling our workforce, be it for medical, clinical, or other technical expertise, which will ultimately uplift the reputation of Malaysia healthcare. Our role as a healthcare provider is to expand the services that we can give, be it in the hospital or outside the hospital. I think especially in the management of non-communicable diseases, things like cancer, cerebrovascular disease, cardiovascular disease, these are all things that will be with us and affect the quality of life. So it means that care is not only delivered in the hospital, it needs to extend into the community, extend across borders, and our service will continue to evolve and adapt to the needs and expectations of this. The recent pandemic, I think, has taught us a lot of lessons about how we have to think differently and keep pursuing continual improvement. So the flagship program has focused and enhanced our commitment, and we will continue to push ahead as a market leader in healthcare travel. And through this flagship program, this means volunteering ourselves for external validation of our services and clinical quality. So our participation in programs executed under JCI, IQVIA, and facilitated by MHTC are part and parcel of our organizational learning. And we are thankful to the Ministry of Health for this opportunity to be a flagship hospital bearing the flag for Malaysia. I think this will serve as a good platform for us to elevate Malaysia healthcare to the world.
Thank you. So now I'd like to know from Mr. Brandlin, how do you think it will be to integrate this flagship program throughout the Malaysia in the future? And how beneficial do you think this will be for the country's healthcare ecosystem?
Okay, thank you for the question. I think first and foremost, I have to congratulate MHTC and Ministry of Health for their foresight and vision in seeing the importance of establishing a flagship program for Malaysia in order to showcase Malaysian healthcare and capabilities. I think MHTC has been a catalyst in giving many of us, represented by my other colleagues here, this opportunity to showcase Malaysia capabilities. MHTC actually equipped and trained Malaysian hospital operators. What does it take to showcase and also to achieve quality healthcare and to achieve medical excellence? And also through this training program, this integration of this program, it gave us a platform to shout out internationally, what we can do. And also other important thing, I think, throughout this flagship program that MHTC have done very well to help hospital operators like us is to consolidate and have this public-private partnership. Because of the good works and because of this first work and we being the first cohorts of 4 hospital finalists going through this program, we are now a face of Malaysian healthcare globally. So I want to thank MHTC and the government for their foresight and leadership to see this opportunity and seize this opportunity to showcase Malaysian hospital globally. I think the excellent initiative to integrate the healthcare program is also good that it actually integrates the beauties what the country has to offer. Malaysia, has a lot of beautiful scenery, holidays, warm weather, lovely food, peace and harmony, multiracial nationals. And then, there's so much that Malaysia has to offer beyond just purely healthcare. To integrate the beauties of Malaysia as well as the medical capability of Malaysia, I think is a great idea. And to make it very seamless for tourists to come over to facilitate their entry to Malaysia, I think is a good thing that Malaysian economy will actually benefit greatly, because the combination of all the stakeholders with a private entity is something that we find that a challenge without this program. And now with this program, it will continue to build on this and make it very friendly for tourists to come to Malaysia, not to seek holidays, but also to seek medical treatment. So I think it will benefit Malaysia greatly because MHTC has created this ecosystem. Thank you.
Indeed, Malaysia is getting a travel destination at the same time healthcare destination. And you're saying that if it can be linked together, it will be much beneficial for the patients and the tourists. So from IGN, I would like to know from Mr. Datu Akmal Arif Muhammad Fauzi, what are the significant priorities or target that have been identified in your hospital and how you are going to address it? May I know?
So there's a couple of priorities or targets that we are aiming to achieve. Number one, since we are a heart center that does 4,000 cardiothoracic procedures a year, CABG, etc., and 10,000 angioplasties, there would be a need to increase our both capacity and capability. So we are into this expansion mode of equipment, modernizing our facilities, etc. That capacity or capability building needs to happen and to cater more and more patients, especially medical tourists. And secondly, we cannot run away from this patient experience, customer experience. So it has been mentioned a few times during our discussion today. It is always about how we can put quality and patient-centric and patient-focused, getting the best experience or delivering the best experience to all our patients, medical tourists included, and to ensure that they are comfortable to be in a country or in a foreign country to get a very important health issue or health treatment to be provided. So that comfort, that peace of mind needs to be able to be delivered in our centers. So that patient experience, customer experience needs to always be consistently upgraded and enhanced. And perhaps number three, the significant priority or targets, okay, but we are the portion about technology. Okay, so technology needs to always be there, and when we talk about health information system, even though we obtain the latest, 2 years down the road we need to upgrade. There's always that consistent investment that needs to happen, in particular in various areas of investment, be it people building, capacity building, equipment, IT, etc. So those investments need to happen, and fortunately via this program there are incentives for such investment. So when we embark on areas that we would like to improve, we are always thinking about improvement. These improvements are required to ensure that patients remain with us, patients are attracted to come to our facility, and patients are well taken care of throughout their stay with us without sacrificing the clinical outcomes. So I guess that would be our little thoughts on that. Thank you.
Thank you. Indeed, gradual improvement of gradual upgradation of the technologies is the utmost demand of this today's modern healthcare system.
Yeah.
So now I would like to know from Mr. Stanley Lam of Mankota Medical Center, where do you want to see your hospital in the next 5 years, and how does this flagship program help in achieving your 5-year aspirations?
Thank you for the questions. Thank you for the questions. And first of all, as you know, we have our 3-year strategic plans. And in fact, when we embark on this MHTC, the flagship program, it just nicely synchronized our 3-year strategic plans. And in fact, right, in a few years down the road, what we expect the hospital to be, not just about Mahkota alone, you know, but the whole healthcare industry of Malaysia. We want Malaysia to be the top healthcare destination for all the foreign patients, because we have so much thing to offer. In terms of medical excellence, right, we have been conducting kidney transplant surgery for a number of years in our hospitals, and we have been having 100% outcomes, you know, for all those transplants held in this hospital itself. So moving forward, the hospital will be continue to focus on all those transplant-based related surgeries. And at the same time, we will be having more program being accredited by this JCI moving forward, and we will provide medical services based on the international clinical guidelines. So in terms of services, the hospital will continue to invest in a lot of patient-centric envelope, including digitalizations, which the hospital recently have been actively embarking on, a smart ward and sort of things, you know, just to ensure that eventually we have a lot more capability, not just when the patients are in the hospital, even after the patient discharged from the hospital, even though they are not staying nearby to the hospital itself. For international branding moving forward, we believe that this hospital will continue to get more recognition moving forward, because we have been given awards, right? The Medical Tourism Award continuously for a few years, being a leading hospital, very much focused in medical tourism industry. We have been getting many offers in terms of getting our people to be recognized for providing good services to our patients. So moving forward, we will continue to stage ourselves to make sure that we are internationally recognized, not just in the Asia Pacific region, but also in the global stage as well. So 5 years down the road, again, I believe, right, with our capability, with our cost structures, I believe not just our hospital alone, the Malaysia healthcare in that perspective, will be shining, and hopefully, Dr. Sanyam, with your support, a lot of Bangladesh patients will find that, right, Malaysia is a good options for the Bangladeshi to come over, because one of the important aspects is that we are a Muslim-friendly country. All these ecosystems is already exist in Malaysia, and this will definitely put Malaysia, in a much more prominent compared to other countries whereby they don't have these facilities at all. Thank you. That's all from me.
Thank you. Thank you. It was a pleasure for me to have all 4 the finalist hospital delegates with me, and we got to know for our people, Malaysia is providing a state-of-art facilities in terms of healthcare and tourism with the value of money, which is very important at the same time. Thank you for attending our show.
So thank you so much, Dr. Sayam. We definitely appreciate your session here today. Even for me, I've learned a lot from the team members here. I think for all of us in Malaysia Healthcare Travel Council, as well as Malaysia Healthcare, we see these 4 are actually the torchbearer of the future forward plans of what's going to happen to this landscape. And particularly, if we would like to say, we also like to welcome more of our patients, preventive or curative care to Malaysia from Bangladesh. And I think this is something attesting to each of our member hospitals who are here today, who are able to deliver not only the ultimate curative options, but also the entire journey of coming to Malaysia, experiencing Malaysia through what we have here in the country. So with that, I thank you so much. And I also thank all the panel members who are here today for taking the time out of your busy schedule to join us in this session.
Okay, thank you very much.
Okay, thank you, everybody. Thank you so much.
Thank you, everybody. Thank you.
Thank you so
Have a good
much.
afternoon.
Bye-bye.
Okay, thank you.